So clinicians are often at the front lines of when patients realize that they are in need of advocacy. And so it can be incredibly helpful for clinicians to connect patients who find themselves having to fight with their insurance company, have to fight to find adequate providers and things like that, and other kind of resources to have at their disposal resources, rare disease resources, or other kind of organizational databases that they can point patients to find out more about their condition at the point of diagnosis, or other resources that are out there to help them advocate for themselves and their disease. It is often the case that clinicians find themselves as trying to be an advocate for their patients, but there's only so much they can do because they only have so much time. And so it's incredibly helpful in many instances to be able to refer patients out to organizations like the National Organization for Rare Disorders who can really help them with those advocacy issues as they come up.
And as a healthcare provider myself, I think that all healthcare providers have an opportunity right now to really enhance care for our patients with rare disorders. And it's truly going to take an interdisciplinary approach. And I think that's where the physicians, pharmacists, dietitians, genetic specialists, they can all work together to come to an appropriate diagnosis and then also allow them to get an appropriate treatment. And I know oftentimes in a traditional medical curriculum, we're taught about all the common disease states, but we're not always taught about the rare disorders. So I think one of the biggest challenges that Tim spoke to was being aware of the resources that are out there to help us make that diagnosis. And that's where the tools at the National Organization for Rare Disorders, they have a fabulous rare disease database on their website. And there's some other web portals as well. And this was something that I had compiled. It's on the ASHP pharmacy webpage. And it's a summary guide for the electronic resources that are out there regarding rare diseases and orphan drugs.
We often see patients have access challenges when it comes to prescribed medication, and when patients experience those challenges, it is often the physician that plays a role with helping them navigate through them. In insurance plans, both public and private, there are often prior authorization requirements so a physician has to certify or attest to the medical need of a patient for therapy. Understanding what kind of barrier that is to access could, I think, really help physicians work better with their patients to help them get through those barriers. There's one issue that NORD works on referred to as step therapy. Step therapy is a insurance policy by which patients are required to fail off a therapy that they may have previously taken before getting the one preferred by their provider. And so a lot of those bills that passed in the states have been a result of physicians stepping up and telling legislators that this policy of step therapy interferes with my relationship with my patient and it's leading to suboptimal care.
And I'll add on to, with the step therapy, I think while there may be medication out there, it's important that our patients understand how to take the medications and what to expect from the medication. And that's where that interdisciplinary healthcare approach may really come into play. The physician can help with prescribing the medication. The pharmacist can work with coaching the patient on how to take it most appropriately. The dietitian may also be involved with talking about it needs to be taken, with an empty stomach or with a full meal. So all of those things I think are definitely going to come into play.
One take-home message I would have for physicians is that there are a ton of patient advocacy resources out there, especially for rare diseases. There are organizations like NORD, disease-specific organizations out there that can help patients. So if a physician encounters a patient who has a disorder that they've never heard of before, chances are, and hopefully, that there are resources out there that can help that patient. And a little bit of work done at the outset can really go a long way towards helping that patient avoid a lot of barriers that they may encounter in their care.
One of my favorite quotes is that a disease is only rare until it happens to you or you make that diagnosis. So I would encourage all healthcare providers, don't shy away from rare disorders. There are fabulous resources out there with NORD, the National Organization for Rare Disorders, that can really help guide and educate healthcare providers.